Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us again. In this segment, we're going to be speaking with John Rothwell, National Vice President, Business Development at Premier Incorporated. It's a leading healthcare improvement company. He's joining us here on the program to talk about how technology is the differentiator in healthcare and its impact on the changing purchasing landscape. Welcome to Health Professional Radio, John Rothwell, and thank you so much for taking the time this morning.
My pleasure. Thanks so much for having me, Neil.
National Vice President, Business Development at Premier Incorporated. Give us a little bit of your professional background and talk about your role there at Premier specifically, if you would, briefly.
Yeah, my pleasure. So I've had the great opportunity to been working at Premier for the last 12 years, Neil, and I actually started off in our supply chain, our sourcing and negotiations arm, working on providing contracts with manufacturers for our member base to be able to use to drive, efficiencies across their supply chain and savings there. And, over the past 12 years, I've had the opportunity to do that, as well as move into our business development function, which is really responsible for recruitment into Premier, recruitment across our supply chain, our technologies, across cost, clinical, safety, and population health. So I've been doing that for about the last 7 years, really out with providers, talking about their specific needs, the challenges that they're facing. And as you can imagine, those challenges have been amplified and shifted since the global pandemic. But it's been an unbelievably rewarding opportunity that Premier's afforded me.
Healthcare improvement company, that, as you say, covers a wide variety of different challenges, different scenarios, different types of providers. What would you say Premier is focused on the most when it comes to healthcare improvement overall as a philosophy?
Yeah, that's a great question. We've got a saying where you've seen one provider, right? Their patient mixes are different, their cases are different, their needs are varied from provider to provider, especially across the geography. But, I would say, where Premier is really focused right now, Neil, is leading that healthcare technology revolution, right? We see a need to continue to drive clinically enabled, data-driven decision-making at the snap of a finger to our providers, right? To help automate these vital business functions, right? Such as supporting clinical decision-making and ensuring care is appropriate and really helping to remove those clinical, administrative, and supply waste that can accumulate, right, without the ability to have that data at their fingertips and that science that goes along to back all of that.
Most everyone has some type of platform, some type of system in place to handle these challenges that you're talking about. What sets Premier apart when it comes to dismantling an inefficient platform and replacing it with one that is more suitable to the advances that the COVID-19 pandemic has presented to us?
What a great question, because there are so many technology and service providers out there. And, I think one of the unique aspects that Premier really brings to bear is the ability to be somewhat vendor agnostic, right? When we're looking at, every provider has an ERP system as an example. And they're obviously not always the same. Sometimes they're not even the same in the same provider setting due to either needs, acquisition, change management, things like that. But we've got the ability to be vendor agnostic and ingest all of their data to be able to create outputs that are all in the same language, right? We can integrate their cost data with their quality data to be able to, in this example, have conversations with supply chain and clinicians to talk about their actual utilization of supplies within a given case setting, meaning what utilization patterns are we seeing and how do those correlate to outcomes, right? If a provider is using maybe too much blood or, too many pedicle screws in a given case, does that utilization mean they have better outcomes or not? And we're able to benchmark off of peers, and we're able to customize those peers so our providers can see what does best practice and best performance look like in a given case setting, to be able to go and have these conversations, right, across the ecosystem of people that touch these items, whether it's supply chain, it's a clinician, or it's a physician, to be able to impart meaningful change, but it's all evidence-based. And I think that's one of the biggest aspects. But one other I would really like to discuss, and it's something that we're so proud of at Premier, which is we have the largest benchmarking database in the country when you're thinking about clinical data, when you're thinking about outcomes. We've got over 100 billion points of data from over 1,100 facilities that really represents about 45% of all of the discharges in the United States. And why is that important? It's because Premier's originating these benchmarks. We're not having to go out and get external sources. Our database goes back tens and, almost 30 years now. And that accurate, robust data really lends itself to that actionable intelligence we talk about. When we really hit on data-driven decision making, that's a huge advantage that Premier has over, maybe some of those others in the market that are having to buy their benchmarks or having to leverage other sources. That is really improving the overall experience for our members.
Do you find that sometimes the technology is better managed by people as opposed to the technology managing itself?
It's a great question. It's probably a couple pieces to that, right? Obviously, the people managing that data, right? Data is only as good as the information that it provides. Right. And so, we are, I think our providers are blessed with just brilliant analysts, statisticians that can take and digest the data into meaningful intelligence based on what they're trying to accomplish. Right. Are they looking at how to reduce 30-day readmissions? Are they looking at overall cost of care by a specific disease state and how that correlates to the story they need to tell internally, right, to improve their overall, one, care delivery, but two, cost of care, because that's something that is just, continues to creep up in the care setting. And a lot of that has to do with manual intervention, right? We've got to continue to automate. And, right, like if you look at an automobile manufacturer, we no longer have people, going out and hammering a door. It's all automated. And what has that done? It's driven down pricing, right? It's increased efficiencies and it's increased capacity. And that's kind of some of the mindsets that we have within Premier as it relates to technology and how we can continue to innovate and automate delivery.
John, give us a website where we can learn more about Premier.
Oh, happy to, Neil. It's www.premierinc, so premierinc.com.
Well, I appreciate you joining us here on Health Professional Radio this morning. Is there anything that you'd like to add with?
Neil, the thing I'd really just like to leave with is, the ability to drive clinically enabled, data-driven decision-making is going to continue to be at the forefront of what Premier is doing to be one of the leaders in the healthcare technology revolution, continue to automate process and continue to provide the meaningful data that is going to drive improvement and drive the conversations in the provider setting to be able to sustain that kind of improvement. So really, I sincerely appreciate the time and the opportunity to speak with you, Neil. Thank you so much.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with John Rothwell, National Vice President, Business Development at Premier Incorporated. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.